The report was only 90 cases. WHO is working on that wherever possible, confirmed mild cases should be isolated. Don't assume your community won't be affected. Prepare as if it will be. Don't assume you won't be infected. Prepare as if you will be.
To avoid some of the worst impacts of the epidemic and to prepare its...
But to suppress and control the epidemics, countries must isolate, test, treat, and trace. If they don't, transmission chains can continue at a low level, then resurge once physical distancing measures are lifted. Treatments are the most effective. We have called this study the... As you know, the first vaccine trial has begun just 60 days after the genetic sequence of the virus was shared by China. This is an incredible achievement. Actually accelerates after a certain tipping point. WHO and its partners are therefore organizing a study in many countries in which some of these untested treatments are compared with each other. This large international study is designed to generate the robust data we need to show which treatments are the most effective. We have called this study the Solidarity Trial. Achievement. We commend the researchers around the world.
At the moment, the incidence of COVID-19 in Africa is low. It may be higher due to lack of detection, but within reason, Africa still has a major opportunity to avoid some of the worst impacts of the epidemic and to prepare its public health system and its health system for this. Emergency testing capacities. So Italy, having experienced the first wave of major transmission much earlier than other European countries, is now experiencing those deaths because a lot of people reach a point where they can no longer be saved in the clinical system. So therefore the deaths occur sometimes 2 to 3 to 4 weeks after the infection starts.
Big religious gatherings in Africa, and is this...
We do need to be very careful when we look at mortality rates and we compare mortality rates. It's not right to compare them yet. What we need to do is find out why we're seeing differences and what that actually means in terms of our understanding of this virus and how it impacts different populations.
First of all, congratulations to many of our member states.
We have not seen the way this virus will behave in other vulnerable populations. We have not seen how this virus will behave if and when we see in vulnerable populations of high prevalence of HIV, for example, or malnutrition children, for example. And that's what we need to prepare for.
If we avoid that, and WHO's recommendation is actually must.
It's like any rush, and we've seen this in the supermarkets and the shops. If everybody rushes to buy everything they think they need for the foreseeable future, then many people lose out. That is the same if it's toilet roll or if it's personal protective equipment. But you know, we can afford maybe to run out of toilet roll, but health workers can't afford to run out of PPE. And it is a huge responsibility for governments around the world to ensure that not only their health workers, but all health workers have a fair opportunity to access PPE. With the manufacture and production of tests mainly aimed at supporting developing countries, I am sure that within days of this virus being sequenced, we were working with scientists and collaborating centres and with manufacturers to produce highly qualified, validated tests that have actually been distributed to 120 countries. They're operating at a very high level of quality and quality assurance, and we're very, very pleased at the way in which they have performed throughout the world over the last number of weeks. The focus here is not how much testing